Thank you for your kind introduction. For today, I'm very honored to be here, and for my talk, I choose this topic to deliver an idea, the broad application of AI in radiology, because there is various background of the student here and the audience here. So I will show you what is the AI that we can use in radiology, because nowadays AI has involved us in many aspects, especially in medical field. And radiology also have application of AI, various type of application of AI. And we should talk about what is AI first. AI is referred to the computer system that capable performing tasks that require human intelligence, like learning or problem solving and decision making, like, as you know, ChatGPT or Gemini or Siri from Apple. And why we should learn about AI? AI is transforming healthcare, and we cannot reject it. It's already involved us. So medical professionals like us must stay updated to adapt and contribute to digital innovation like AI. And the second one, imaging volume rising. So imaging, radiological imaging come to the gold standard in many diseases. So they have to use imaging to diagnosis or to treatment, to select treatment for patients. So AI can help to improve reporting speed and quality and job satisfaction. And also AI also bring a risk like other AI. AI in radiology also bring a risk if we doesn't know the limitation of it, or even we not understand the working process of that AI that we gonna use. So we should understand the background of the AI first, and then we can use it more effective. And this one is evolution of AI in medical imaging. So it come a long time ago after X-ray that was discovered in late of 19th century. We keep developing the hardware machine related to the radiology. We develop the ultrasound and come to the CT scanner and MRI scanner, and we have first research on AI in mammography around 1990, and we have first FDA approved AI-based algorithm around 2017. And in this talk for application of AI, I will classify it into two aspects. For the first one is image acquisition and reconstruction, which focus to directly useful for radiation technologists, because this type of AI we can use AI to make us work more smoother, better, more efficiency. And the other one, AI as a second leader, I classify it because it the purpose of this AI is focused on the radiologist or like the user or general doctor who use it to help them as a second opinion, something like that, to help to treat the patient better. Let's see the first one, AI in image acquisition and reconstruction. The first application is denoising and improve image quality, which we can use it like to improve the image quality as the name. So in the case of we gonna examine the children or something like someone who need to reduce the dose, like in children the cell is a growing cell, right? The cell is very sensitive to radiation dose, so we need to reduce the radiation dose to them. So after we reduce the radiation dose to them, it comes with the quality, image quality will drop down. And the image quality is drop too much, it affects to the radiologist to interpret the meaning inside the image. For example, this one. So it comes with the noise. This one example from GE Healthcare. they use 40% reduction of radiation dose, and you can find that the image is more noisy. And then they use AI named True Fidelity to increase image quality, so the image are more smoother and more see clearer. The background of the model of AI is kind of similar to all the deep learning model. It's comprised of the input, algorithm, and output. For input, they have a noisy low-dose image CT or raw data like sinogram to be as an input. And then for algorithm, so they can select the algorithm like deep learning model named convolutional neural network or CNN to map the noisy input with a ground truth. And then training your model until it aligns with the ground truth, so you can get the best quality of the image. And the algorithm that you choose to construct the AI of this type, it directly reflects to the image quality that you get. So more smoother doesn't mean that it's better, because if you get the more smoother of image, it may affect to the interpretation of the disease. So the other one is some algorithm come with the artifact. So you have to just try each model and see the result. So you should use it properly. The second application is AI for automate patient positioning and scanning. And this one can enhance workflow efficiency and reduce human error by collect the ISO sensor of the patient or automate select the scan range of the patients. It's currently there is various type of the machine come with a various company producing AI powered scanner like Siemens, GE, Philips, or Canon. It comes with a camera, mount at the ceiling or gantry. This is an example. Mount in the ceiling and mount at the gantry of the CT machine like this one. And after they collect the capture the patient image, the patient posture, they send back the image to the AI software and automate calculate the location of the patient and automate calculate the scan range of the patient. This is background that they calculate. They capture the patient posture like in RGB image like this one and put it into the deep learning model and predict the X, Y, and Z location and tell back to the machine how to adjust it. For the second one is AI as a second reader. The first example is segmentation. For this one, we can use AI to automate labeling or outline or contour the region of interest or ROI in the image. And of course, after we identify the ROI, which is, for example, maybe a tumor or the organ that we interest or bone or vessel, and after we can contour the region of interest, so we can automate, measure the volume or the shape, accessing the shape, or just follow up for the next time the patient come back, and then automate calculate them, so it makes the doctor work easier. This is example. Automate measure, automate contour the skeleton or vascular system or organ or GI tract or muscle. Or the other one, it's non-small cell lung cancer segmentation. There's a nodule inside the lung images. Or you can automate segmentation, so the next time that patient come to visit again and follow up the disease, it can automate contour and measure the volume, is it decrease or increase of the size. The second example is we can use AI as an image classification. which is assign level and categorize the entire image. So we can put all of the whole image into the AI model and then automate classify the disease. There is a disease in the image or not, or lesion in the image or not, or this patient is a COVID-19 patient or not. It can automate classify. This is an example of the research. They use whole body CT scan from CT lung, whole abdomen to KUB system. And if that image or imaging slide show the lung region, it can predict the disease in that region. For example, for emphysema, or this one there is a fluid, so effusion or lesion inside the liver or stone inside the kidney. So they can automate classify the disease. And the third one, AI for automate detection and localization. It's kind of similar to the previous one, which is a classification, but it's more in detail than the previous one. Previous one, we just put the whole image to the AI model, and then AI model tell us there is disease or not. But for detection and localization purpose, they can localize or point out which is the part that in the image that they think they're gonna have the disease. For example, this one. There is a nodule inside the lung region. This is from CT lung. So they can identify or localize the nodule inside the lung by color, like this one, the green colors. Or even the application like intracranial hemorrhage detection, for example, subarachnoid hemorrhage or subdural hemorrhage. This is very useful for the countryside area or the hospital that has they have only the general doctor. They doesn't have the radiologist or surgeon to consult. So if they have kind of this AI to as a like a second opinion, so they can treat the patient in time because there is a hemorrhage inside the brain, so they need urgent treatment, right? For number 4 is triage and workflow prioritization. For this one, we can use AI to prioritize patients. This is actually consequence of the number 1 to number 3. If we can segment, if we can classify patients, if we can localize the lesions, so we can know that this patient gonna be urgent treatment or something, so we can prioritize them to make a treatment management for them. Or in this research, they use AI to detect patients who have pulmonary embolism and then rearrange or prioritize to make a radiology report. From zero day, they reduce the time, waiting time into only 1 hour to get the official reports. So they can receive the treatment in time. So is it too short? In summary, AI isn't just change the medical imaging like radiology like we do. So it's setting a new standard for accuracy, efficiency, and predictive power. And today we have seen how AI is reshaping radiology, but AI doesn't just for radiology. We are in health science, right? We have rehabilitation, we have lab tests, we have nursing care. So if we everywhere we can do the AI, we can collect data together and interpret the data like AI in radiology. And it's as a future of healthcare profession, we hold a piece of the data puzzle. If we put it together, so we can make the patient well-being better, have a good health and more efficiency treatment for patients. That's it. So thank you very much for your listening. And this is Chulalongkorn University. So it looks like temple, right? But it doesn't temple. It's an old building of Chulalongkorn University. So I would like to invite you all to visit us at Chulalongkorn. So see you there.
Thank you very much.